Good morning, my name is Valentina González from Parallel A, and today I'm going to talk about hyperkalemia after missed hemodialysis. Definition. Hyperkalemia is the medical term that describes a potassium level in your blood that's higher than normal. Potassium is a chemical that is critical to function of the nerve and muscle cells, including those in your heart. Your blood potassium level is normally 3.6 to 5.2 millimoles per liter. Having blood potassium level higher than 6 can be dangerous and usually requires immediate treatment.
With hyperkalemia, hyper means over and cal refers to potassium, and emia refers to the blood. So hyperkalemia means higher than normal potassium levels in the blood, generally over 5.5 milliequivalents per liter. Now, total body potassium can essentially be split into two components, intracellular and extracellular potassium. Watch the full video on osmosis.org.
Pros and cons. The management of hyperkalemia is multidisciplinary because of its potential to induce cardiac arrest. Once hyperkalemia is diagnosed, the primary condition must be treated if the hyperkalemia is severe. The nephrologist should be consulted. If ACE changes are present, a cardiology consult should be made. Treatment to lower the high potassium should be ongoing. These patients need cardiac monitoring 24/7 until the hyperkalemia has resolved. The majority of patients have an excellent prognosis. However, patients with chronic disorders like end-stage renal failure may require continual blood work to monitoring potassium.
We have 1 critical minute to focus on the ECG changes in hyperkalemia. Let's go. The first changes that occur as potassium levels rise are the peaking of T waves. Next, the amplitude of the P wave decreases and the PQ interval increases. The QRS widens severely. As potassium increases further, the shape of the QRS segment and the T wave become more sine-like. This is highly associated with ventricular fibrillation and with that, cardiac arrest. If you have a patient with hyperkalemia that has a wide QRS segment, keep them on the monitor at all times. For more information on hyperkalemia, including treatment, watch my video on it. You are dismissed.
Application is medicines. Patients with chronic hyperkalemia may have relative normal ECGs even at high level, and significant ECGs change may be present at much lower levels in patients with sudden spikes in serum potassium. Additional laboratory testing should include serum blood urea, nitrogen, and creatinine to assess renal function, and urinalysis to screen for renal disease. Urine, potassium, sodium, and osmolality may also help us in evaluating the case. Issue apply in Ecuador. In Ecuador, the problem lies in our peculiar health condition. The necessary inputs are not available to prepare a solution standard polarized, so it has to be adapted to available inputs that have not been approved with appropriate investigation. Hyperkalemia occurs frequently due to a iatrogenic cause and is therefore a preventable alteration. It is treated most frequently disturbance and has reported incidence of 1.4 to 1.7% in hospitalized patients. Conclusion. All dialysis treatments have their advantage and disadvantage based on your lifestyle and medical needs. You and your doctor can discuss your option and decide which one's the right for you. Thank you very much.